doctor. My name is EshikaParuchuri, and I'm studying 11th grade at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate and empower adolescents around the world to help them construct a healthier lifestyle by working with experienced doctors across different fields around the world. In addition to promoting health education, I hope to inspire many interested teens to pursue careers in healthcare and medicine, not just as future leaders, but as individuals prepared to respond to urgent public health challenges, from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Sujana Priya, who specializes in radiation oncology. She has vast experience in this field, working as a senior consultant radiation oncologist in Hyderabad, India. And for this episode, we'll be focusing on general facts related to this field, public health issues that concern teens, as well as the steps that can be taken to have a healthy lifestyle. And now, Dr. Sujana, can you give us a little background regarding your experience in this field?
Yeah, hi, Eshika. First of all, thank you for having me on your podcast. I'm really glad that I'm here with you today. Yeah, and thank you for a kind introduction as well. Okay, fine, great. Now let's go with a brief introduction of me. So, as you have already introduced me as a radiation oncologist, I'll take it from there. So, I finished my radiation oncology in 2013 from Osmania Medical College. And then I have been practicing. So I worked in a hospital where it was affiliated with UPMC Pittsburgh. So that I was able to kind of connect with a lot of radiation oncologists in the US. And I was very fortunate to visit the US also for a couple of fellowships through my associations with, a lot of doctors abroad. So after that, I went on to finish my fellowship of Royal College of Radiology, UK, and right now I'm working in AIG hospitals in Hyderabad as a consultant, senior consultant radiation oncologist. So that's briefly my background. So, yeah.
Wonderful. Okay, so let's dive right in. How common are cancers in India compared to other countries, based on your experience?
Precisely, I cannot give you the numbers, but the thing is, cancer is becoming more and more common. Again, it depends on place to place in India. So, for example, if you're living in cancers are stratified between men and women. So, women, if you're talking about an urban woman, we usually look at breast cancer as the most common cancer in women. So if you go to the rural population, even now cervical cancer is more common. If you come to men, lung cancer, head neck cancer, these cancers are very, very common in men. So the geographical reasons or the lifestyle reasons or because of many other lifestyle choices, the cancer proportions of the cancer, what is common in India is not common in the West. For example, prostate cancer is very commonly seen in the West, and colorectal cancer is very commonly seen in the West as you age. But in India, it is not. It is becoming more and more common because of the westernization of our habits. But yeah, still, if you look at the broader picture, the cancer cohort is completely different as compared to the West.
What would you say was the most rewarding and challenging part of your training?
So the most rewarding part is seeing patients get cured. So because oncology, in radiation oncology especially, the division is like that. 1/3 of your patients only you can cure. 1/3 of patients, they become metastatic. Other 1/3 of patients are essentially palliative. So technically, you're dealing with those 30% of patients those 30% of patients really, give you some confidence that yes, there is something to look out for. And these days, the scope of oncology has expanded beyond horizons with a lot of systemic therapies coming up. a lot of advancements in radiation oncology and a lot of integration between systemic therapies and radiation therapies. So we are looking at long-term survivors these days. It never happened back in the day when I was training. For example, if a carcinoma lung patient, stage 4 lung patient came back in the day, we just used to write him off telling that, okay, you hardly can live up to 6 months to 1 year, not beyond that. And that too, I trained in a government hospital where you cannot access a lot of drugs back in the day. So now you have a lot of access to immunotherapies, and thanks to Jim Allison, who discovered, and he was also awarded Nobel Prize for discovering immunotherapies from MD Anderson Cancer Center. So a lot of systemic therapies have come where they're extending even stage 4. You're looking at a survival of about 60 months these days if it's a very good risk cancer. So back in the day, it was not like that. So I think this is the right time where we are in oncology. I mean, at least I am in oncology, where we are looking at good survivals for patients, even though they're stage. We can at least tell the patient, see, hey, even though it's stage 4, you don't really have to worry. We can give you some drugs which will work, and you will probably live at least for 5 years. That's a good time. It's a good time for a stage 4 cancer patient to live. So that is the most rewarding. I would not say rewarding experience, but I would say this is the most rewarding times we are in right now. Just right time in the right place. That's it.
Radiation therapy makes you radioactive.
No, absolutely not. There are a few radiation therapies where it can make you radioactive, but these days most of the centers they are not doing. So we keep introducing some seeds called iodine seeds or palladium seeds or iridium. Iridium also. So, but these are all temporary. So we try to take adequate precautions. So in India, most of us, I mean, at least I don't do these radioactive insertions in the body. So even if they do, the patient will be isolated completely. We do only for certain cancers and for certain indications. But most of our practices are external beam therapy, wherein this is a very common question patients keep asking. We have kids at home after radiation. Can we handle them, or can we play with them, or can we take care of them? Absolutely. Once you're under the linear accelerator machine, if you switch on, only the radiation is going to come and kill your tumor. Once you're out of the linear accelerator room, or rather you call it a linac bunker or a console, you're like anybody else. You're just a normal person, except the fact that you're a patient. You don't have to wear that badge on you and tell them I'm a patient. So it will not show on you, or you're not a radioactive person. You're like any other person in the world.